And welcome back. I'm Mabel Jung, and you're looking at day 2 coverage of the World Healthcare Congress in Washington, D.C. Thanks so much for joining us. And in our studio right now is Dr. Neil Evans, who is co-director Connected Health at the Department of Veterans Affairs. Thank you so much, Dr. Evans, for being here.
Absolutely. Thanks, Mabel.
Well, it's a fascinating area that you get to work with every day, the area of connected health. Tell me how your systems were put in place at the department and how it's going there.
Sure. Well, connected health, or what we sometimes call connected care, either one, is a way that we as the Department of Veterans Affairs, in particular the Veterans Health Administration, really extend the reach of healthcare into veterans' daily lives, in between their traditional healthcare appointments. The VA, we serve on the order of 6 to 7 million patients per year at more than 1,400 sites of care, so we're a pretty large healthcare system. We use really the 3 big components of that we leverage as part of our connected care and connected health portfolio are our patient portal, My Healthy Vet, more than 3 million veterans using our personal health portal, communicating back and forth with their healthcare team. Our mobile program, we have 25 mobile apps on our app store and numerous more to come. And our telemedicine program, which allows us to deliver care at a distance through technology. We deliver more than 2 million encounters per year through our telemedicine program in the VA. For us, this is actually a critical strategic priority focused on access.
Why is it so crucial?
Well, for us as a healthcare system, the VA, when we enroll a patient, we're responsible for being able to deliver them healthcare wherever they are geographically. And so our ability to use technology we're in a pretty large country, to bridge large distances and get the right healthcare providers' expertise to the right patient at the right time is absolutely critical. And telemedicine, connected health interventions are a critical piece of that.
Now, how are your patients, members of the VA, responding to this? Are they receptive to being able to do some of their care online, to maybe not see someone face to face, but use connected health to really get the care they need?
Sure, I think so. I mean, they definitely are. And we see this, in 11%, for example, of veterans every year have at least one encounter through telehealth at a distance, whether that be a video visit, a store and forward telehealth visit where, for example, a dermatologic lesion, we capture it photographically and send it to a provider, or through remote home monitoring in the home. And that number continues to increase year on year. Similarly, engaging through our health portal, through My Healthy Vet, continues to increase at a really rapid clip. The number of veterans who are engaged with their providers using secure messaging to communicate and essentially have electronic visits. I think a lot of this extends out of, it occurs because of the relationship that patients have with their healthcare providers. Yes. And our VA providers increasingly are recommending that veterans engage with us through technology, through My Healthy Vet, through our mobile applications, and that drives adoption over time.
Absolutely. Now, for other organizations who would like to have as organized and as involved a system as what you have in your department, what are some of the main components, do you think, will really lead to success in implementing that kind of program?
Right. So I think focusing on the relationship between the patient and the provider is very important. And if you're going to do that, you have to make sure that that these programs fit into providers' workflows and make sense to them, for providers to adopt using technology to engage with patients. And similarly, you have to make it easy for your patients to find the tools to understand what they can do online through a mobile app, what's available to them. I mean, a lot of this is there is complexity in delivering care using technology, but a lot of what is important in my mind, for healthcare systems to do is to make that complexity fade away for both the provider delivering the care and the patient receiving the care.
Attendees were able to hear you speak today in a session. What were some of the key takeaways that you left with people?
Well, we had a very interesting session talking about, in particular, about mobile health and wearables, and how we should be and how we collect data from patients, how healthcare systems can collect data from patients in ways now using technology that we were never able to do before, and what impact that's going to have on healthcare delivery. Yeah. And I think one of the key take-home points that came from across the panel was the importance of these of this interchange occurring in the context of existing healthcare relationships. That is, where patients and providers are talking about how we're going to use data that you, as a patient, may be collecting at home to inform your healthcare, how we're going to collect that, what we're going to do with it, and making sure that everyone's on the same page in order to, improve healthcare, so that folks understand how this technology is helping them, and also providers understand what's being expected of them, and how they're going to use this data. And across multiple healthcare systems, it seems like this is a common theme.
Absolutely. Okay, Dr. Evans, may I ask also, why did you decide to put this particular event on your busy calendar?
Well, I've participated before in World Healthcare Congress events, and I've found them to be a good venue for interchange of ideas. In addition, it happens to be in my hometown, which is great. Beneficial. So I can be here learning all day about healthcare, and then go coach a Little League game this evening.
Excellent. Sounds good to me. Thank you, Dr. Evans.
All right,
Thank
thanks.
you. And I'm Mabel Jong. Thanks for watching. Stay tuned.